Hello, good evening. I'm Eric Strujanka. I'm the County Health Officer here in Mariposa.
And I'm Siobhan Guttari. I'm the Health and Human Services Director here for Mariposa County.
And so this evening had been set aside to talk about both the California roadmap to modifying the stay-at-home order and our testing here in Mariposa. But I suspect a lot of people on Facebook know that we got our first confirmed case in a Mariposa resident today. We were notified of that early this morning, just as I was getting to work. We started doing some initial contact investigation at that time, and we're continuing our contact investigation at this point. So what I can tell you within kind of the public health rules of privacy is I can't tell you anywhere less than 20,000 people where a person is at. And so I can tell you that person is in Mariposa. She is a female in her 20s. We know that she acquired the case from a confirmed COVID case from outside of the county in another jurisdiction. Again, we're continuing our investigation, and what we're doing is public health in conjunction with the sheriff's office has a contact tracing unit. And they have been out all day, either by phone or in person, doing contact tracing and placing those people who are close contacts, that is, people who are within 6 feet for 10 minutes or longer with this person, since she's developed symptoms, into quarantine. And they're continuing that as we speak. There are some people that we've run into that have been symptomatic, and so we will be planning on testing those. And actually, of those people that we've run into, 2 of them have already been tested. So we have a cluster going on, and we're continuing the investigation of that cluster. But what I can say is so far, we've been able to find all of the contacts of that individual. And so we don't have continued community spread or spread outside of that particular cluster. So that's good news. And I think it actually reflects what we've developed here in Mariposa County, that allows us, that what we had predicted would allow us to respond efficiently and effectively to our first case. We've practiced, we've trained, and it's really come together actually better than I was expecting and with fewer hiccups. That said, there's a lot that we need to still do. There are things that we ask you to do as always. Limit yourself to essential travel. Stay at home if you're sick. Consult a medical professional if you're ill and feel like you need to be evaluated. Good hand hygiene, all those things that we've been talking about since the beginning of this outbreak. But shifting back to what we were going to talk about is this contact tracing unit is one of those capabilities that the governor's roadmap to modifying the stay-at-home order is all about. There are what I call 6 capability areas, or what the governor calls 6 indicators that we have to have in place to go ahead and relax some of those stay-at-home orders. So number 1 is what we're talking about a little bit tonight, which is contact tracing, isolation and quarantine, and testing. Number 2 is protecting our at-risk population. So protecting those people who are older than 65 and those people with pre-existing disease like hypertension or diabetes. Number 3 is the ability to surge in the event of increased number of cases. So John C. Fremont is doing that. We're doing that in conjunction with them. Capability area, or indicator number 4, is therapeutics. And those are new drugs, new therapies that will help people should they get sick. It also includes immunizations when those become available. So we're just monitoring that particular indicator because we're not developing drugs here at Mariposa. Indicator number 5, or capability area number 5, is physical or social distancing. That's how we're going to reopen businesses, reopen schools, reopen childcare, so that they can function in the environment we're in right now. And then the last area, or last indicator, is what we call indicators and warnings. Those are things that we will be monitoring throughout this outbreak for the next 12 to 18 months, and associating with those indications and warnings, layering on as we need to mitigation strategies, or taking them off depending upon the number of cases we're seeing at any given time. So those are all indicators or capability areas that we're looking at in the roadmap, but we were going to talk a little bit more about testing, and Siobhan's going to talk about that.
Great. So we've been doing a lot of planning here in Mariposa County, and we feel really ready to approach most of these indicators. What the governor announced just about a week ago was that he would be deploying about 86 additional specimen collection sites throughout the state. We were selected as one of those sites to increase our testing capacity. So we're very lucky to have been chosen for that. What it will do is it will allow us to just have a better read on what's going on in our community from a surveillance perspective, but also allow folks who are symptomatic and first responders to be able to be tested at a frequency that allows us and at a pace that allows us to really keep track and be able to isolate and quarantine folks as necessary. So this testing site, we've been working on planning for the past week. We are ready to launch it this Thursday, and we're looking at actually doing a soft launch this Thursday and Friday for primarily first responders and folks who are symptomatic. And then next week, starting Tuesday, the testing site will be open from Tuesday through Saturday each week for the hours of 7 a.m. to 7 p.m. And we're going to be able to test 132 people a day, which is really a good number for a community our size. So we're very lucky to have this, as I mentioned. I wanted to just mention a couple of things in terms of priority populations. We've taken the state and the CDC guidance, and we've looked at our own population, and we've determined some priority areas for testing. So first and foremost, we want to ensure symptomatic folks get tested. So these are healthcare workers, these are first responders, these are folks who have a lot of contact with the public who may have symptoms. They will be our first priority area. We also want to test those folks who are symptomatic in the general population. We are also going to be testing those people who have had close contact with people who are either symptomatic or who have been found to be COVID positive. Additionally, after those first priority areas, then we'll move into folks who are not symptomatic. We'd like to be testing first responders and healthcare workers every 2 weeks. That's a good incubation period where we can test them on a regular basis to be able to check and ensure that we're not seeing the virus within these essential employees. And then additionally, we're opening it up to the general population. So anyone who feels like they'd like to be tested will be able to be tested. There's going to be some information coming out to the community through Facebook that will allow you to go online and schedule a test. And you'll be answering a few questions, and then you'll be able to schedule your own test. And our site that we're setting up in partnership with the school district, so I wanted to thank the school district for the use of one of their unused school sites on Silver Road. We're setting up that testing site to be able to have folks go there and test. And if folks need transportation to be able to get to testing, we're also able to provide that as well. So once again, if you reach out to us at 966-2000, you'll be able to get some more information about that. And so that's the overview of testing. And now I'd like to open it up for any questions.
All right, the first question is from Richard. When will Airbnb hosts be able to rent again?
So good question, without really a good answer. As you know, the stay-at-home order originated from the state, and that limits non-essential travel. And so at this point in time, the only thing that an Airbnb, or for that matter, hotel, motel, any short-term lodging can open their spaces to are people that are involved in essential travel. So once the non-essential travel ban is lifted, then you can open it up to other people. That's really, we can only anticipate when the governor and the state health officer will lift that. But even then, what we do know from the roadmap is that going through a 4-phase process, we're in phase 1 right now. Again, no non-essential travel allowed. That non-essential travel ban will continue through the first phase. Once we're in phase 1, I anticipate we'll be in that for at least 2 weeks, if not longer. It's not until we get into phase 2 that non-essential travel is permitted.
All right, thank you. The next question is from Tom. Is everything going to open up on May 1st?
So based on what we heard from the governor today, the answer would be no. He had announced earlier that he was expecting to make a decision about opening things up on the 1st, or make a decision about opening things up, and he was going to make that announcement on the 1st of May. Based on what we heard today, it sounds like he's talking about weeks until we can open up. And I think that's actually a fairly good decision based upon the activity that we're seeing in Los Angeles right now. And honestly, what we're seeing here in Mariposa, the case investigation that we're doing right now, we're being helped by this stay-at-home order, and allowing that to continue for at least a week longer at this point will help us out with this investigation that we're doing right now.
Okay, next question is from Carol. Can anybody test?
Yes, so the answer is anybody can test. Fortunately, we're in a situation with 132 tests a day where we don't think that we'll have a capacity issue. And so, like I said, this Thursday and Friday will be a soft launch where we're asking first responders first to test and healthcare workers. And then starting Tuesday of next week, information will be coming out so that the general public will be able to sign up for testing if they choose to do so.
Next question is from Crystal. Is JCF not testing anymore?
So JCF is actually still testing. They're still a Quest testing site, so they will do swabs. But really what we're prioritizing, and I've talked with the staff there, the team there, is we're prioritizing them towards acute cases that may be hospitalized or may need to be transferred to another facility. And so they're online with that. The other thing is for the future, they will have a molecular testing capability there by the 1st of July, maybe sooner. And we're excited about that as well, because that will give us even quicker turnaround time than what we have right now with either Quest or with this specimen collection site.
All right, the next question is from Catherine. Has the person that tested positive been to any of our local businesses?
As best we know, not at this time. We've done our contact tracing. Pretty much she has been a stay-at-home person, which is fortunate for us. But then we're looking at the contacts of that individual and see where that person's, where those people have been at. So stay tuned.
Question from Jan. Will all the people who came in contact with the infected person be tested?
So the likely answer is yes, given that we've got this larger testing capacity available to us starting on Thursday. Initially, I was thinking that we would only be testing those people who were symptomatic, who were in contact with this person. But given this additional capacity, there may be some value in testing. Now that said, realistically, you have to think about the incubation period and allowing that time to elapse, like 4 to 5 days from their exposure, and then test them. At that point, they may be more likely to turn positive.
All right, next question is from Sarah. For the new testing site, is this a nasal swab test or an antibody test?
So it's a nasal swab test. It's the PCR, so it lets you know whether or not you have the disease right now, or at least that you're carrying the virus in your nose. They are anticipating down the road adding serology testing onto that, which is a blood test. But at this point in time, they're not doing that. I will say though, is that serology testing is available through Quest, but the big proviso with that is it's a little bit better than a coin toss. What we know is what's called the positive predictive value is about 58%. That means it's 58% likely that if you have a positive test, that you actually have the disease. So more likely, or as likely, that you'll have a false positive as you will a true positive.
Okay, the next question is from Suzette. Which symptoms did the young lady have? Which country did she catch it in? Oh, I'm sorry, which county did she catch it in? And where was she tested?
So she had some of the typical symptoms of COVID-19, some mild symptoms, cough, I'm trying to think, a little bit of shortness of breath, but very mild. And then she was tested in Madera County. And then I will say it's travel from a foreign country.
Okay. Next question is from Lene. I know someone who has recovered yet still tests positive after 9 tests. Can you explain a bit on this? What is the test picking up?
So what it's looking at is RNA presence, so the molecular stuff that makes up the virus, and that can actually persist in your nose for quite a long time. And the idea is that after your symptoms have resolved, you may have dead virus still collected in there, and it just takes a while to clear out.
Next question is from Beth. Do you have to have insurance to be tested, and will there be a cost?
So I can answer that. When you go online or telephone in to register, they will ask for insurance information. If your insurance provider pays for that, that's great, but if not, there is no cost, and there's no cost to the county either. So no cost to the individual, no cost to the county.
All right, the next question is from Carla. Would a hazmat worker that is doing decon of facilities that may have had positive cases be considered a first responder that could be tested every 2 weeks?
Yeah, we would definitely. So one of the things we've done is we've issued guidance and protocols for folks who are cleaning facilities where folks who may either be ill with COVID positive or may have resided. And so we would definitely encourage folks who have been around the virus to get tested and could get tested every 2 weeks if that was their normal day-to-day job. What we're looking at is folks who have regular contact with the public or with the virus. So yes, we would consider that.
All right, next question is from Mike. If you are so worried about transmission, why are you still allowing essential employees from other counties?
So good question. It's reasonable for us to have these essential functions going forward, and so it's a risk-based decision. Just like we're limiting non-essential travel, we know we need to have functions going forward with essential workers, and we don't house those workers here in Mariposa. If you think about, as an example, where our sheriff's deputies live at, not all of them live in Mariposa. Some live in Madera, some live in Merced, and we need those functions to continue forward. So we're cognizant of that. It's a risk-based decision that we make. That's why we ask people to limit the non-essential travel. And actually, even if you live here in Mariposa and you want to go, say, down to Merced to get something, think through that. Say, is that essential travel, or is that something I can live without for a couple weeks or a couple months?
Next question is from Shannon. What kind of testing is it, and how long to get results?
So it's PCR testing, as Dr. Sergienko mentioned. It's the nasal testing and the swab, and so we're looking at 24 to 48 hours to get results. And what will happen in terms of results is if it's a negative test result, the person will get texted or emailed based on the contact information they give. If it's positive, then we will reach out to them from the public health department to give them some more guidance.
All right, next question is from Crystal. Are businesses going to require face masks?
So I can't say that businesses will require that because that's an individual business owner decision. But currently at the county level, it's just a guidance, a recommendation that a business owner or an employee who cannot maintain distance or maintain social distancing, can't be 6 feet away from people, wear a mask to limit droplet spread. But again, that's not a health officer's order, that's just guidance to employers and employees.
Okay, next question is from Sandra. Is testing going to be done on people who think they have already had the coronavirus?
I'll let you.
Okay, so that sounds like a question about serology. So Again, you can ask your provider for testing of that. That's available to you through Quest, but like I said, that's a coin toss, a little bit better than a coin toss at this point. And so if you get a positive on that, it may be a true positive, it may be a false positive. But that's something you can still get. And then sometime in the future, perhaps at this specimen collection site, they'll add serology onto the nasal swab. But that's something for the future there. And also I would expect in the future, better testing to come out for serology. But at this point, it's great, or it's good for population surveillance, not so good for individual test results.
All right, next question's from Catherine. Why are large groups of tourists on motorcycles still being allowed to come into our community when we are being told to stay home?
So I can take that. So basically, folks are not really being allowed, if you will, to come into the community. There is a statewide stay-at-home health officer's order. And so essentially, when folks were coming into the community this past weekend, and a lot of communities were seeing heightened travel this past weekend, probably because the weather was a little bit nicer. Our law enforcement deputies were responding to that. They were going out and reminding people about the stay-at-home order. So once again, it's one of those things we're discouraging folks from coming, and that's what we can do at this point.
Next question is from Cindy. Is there a means to determine if any of the Madera County cases are from Oakhurst without violating HIPAA?
So yes, is sort of the guidelines with HIPAA and other Privacy Information Act stuff is that you can define a geographic area of 20,000 people or greater. And so what has happened in both Merced and Madera is they'll describe someone as being from the east side or the west side of the county. Merced has been more explicit about them. If you go to their website, they'll actually say, hey, they actually split up their case numbers by location, east or west. Madera isn't quite there yet, but if you ask them, they can divide that out. And then honestly, what you'll also see in some cases is where there is a agency that's involved, they'll release that information separate from what the public health department is able to do.
All right, the next question is from Amelia. Will there be tests for those who live and work in Yosemite?
Yes, Yosemite is our partner in this, and they will definitely be giving their first responders, their residents, and even visitors access to testing as needed. And so currently they are doing testing in Yosemite Valley at the clinic, but this testing site will be available for them to do new employee orientations, for instance. As new employees come on, they may ask them to test. Additionally, their first responders will be tested. We are working with OptumServe, who is our testing specimen, the organization that's doing this, to see if in the future, if we can actually move testing around and maybe do a day of testing a week in Yosemite Valley. We don't know that that will be the case yet. It's something we're gonna push for as a small community with a large geographic boundary. But right now, we'll be doing testing here right outside Mariposa in the Boot Jack area, and Yosemite is very much a partner in that.
All right, next question is from Suzette. Can the Butterfly Festival still happen in July?
Yeah, to be honest, we don't know. It's a possibility, and going more into detail on the phases that the governor outlined is that, again, we're in phase 1. To go into phase 2, we have to have capabilities that allow us to respond to surge, to protect our at-risk population, to do adequate amounts of testing, and to be able to do contact tracing. That will allow us to move into phase 2. Phase 2 allows for non-essential functions, some of those businesses to open up. Does allow for some more activities to happen, but certainly nothing like the Butterfly Festival or the fair. Then the next phase, phase 3, happens when we meet another set of gateway criteria that have yet to be determined by the state. And then once we move into that, that's kind of where we start seeing gatherings happening, gatherings of 50 or less, but it's not until we get into phase 4 that we see us moving, having the ability to have large scale gatherings. So my thought is that it's an unlikely thing, but a possibility. And so at this point, stay tuned. Again, we don't even know what the gating criteria from phase 2 to 3 and 3 to 4 is. So it's hard to determine whether we're going to be able to do that or not. But I will say my larger concern is that with large scale events, we're probably looking at until we have vaccination or large scale herd immunity in place.
We have encouraged folks who are organizers of some of these large scale events to think about strategies that they could put into place to have them be smaller scale events, but maybe multiple smaller scale events. So there's possibilities by the summer that we'll be able to have smaller gatherings or cohorts, as we call them, to get some of these events up and running, but in a very different way than they've looked previously.
All right, there's a couple questions here I'm going to combine. Some questions about antibody testing, serology, when that will be available, and if there's a cost associated with testing people that are asymptomatic.
So for the asymptomatic people, for the nasal swab that's being done through the specimen collection, they will bill your insurance if you have insurance that covers that. But if they don't, then the nasal swab is free to you. That said, with the serology test, it is a cost. Whether the insurance covers or not is something you need to determine with your insurance company up front. If it comes eventually to the specimen collection site, I suspect the same rules will apply to the serology test as it's the nasal swab. But currently, as I mentioned, Quest is the only lab in our area that currently does that. And that would, again, be at a cost to you or your insurer.
The other thing I think is important to mention that I didn't is that if a person wants to get tested at our testing site, the OptumServe testing site, they actually don't need to see their own medical provider first. So normally you would need an order from your own medical provider, but Dr. Sergienko has been able to write an order so that folks who want to get tested at this site will be able to do so.
All right, next question is from Greta. If our clinic is testing, why would they turn away some people that I know who have had symptoms? They were told to go and stay home or to go to Merced.
So that, again, is a clinician decision. It's not a decision that we make here at the Health and Human Services. So if the provider who is seeing that person decided not to test, that's a decision that is between the provider and the patient. I don't know why they suggested going to Merced, so I would be speculating on that.
And I'll just add to that is that, up until now, our testing capacity throughout the state and the country has been more limited. And so when tests are limited, providers often have to prioritize, just like I talked about the priority populations up front, have to prioritize who gets tested based on symptoms. And so I just wanted to say that with this increased testing capacity, we'll be able to test a lot more people than we had to prioritize early on in the disease spread.
All right, the next question is from Terry. Is the testing just to see if you have had it or if you, is the testing just to see if you have it or if you have already had it?
Have it.
Have it.
Yeah, it'll only be positive if you have the RNA, which could be dead or alive, in your nasopharynx when they swab it.
All right, next question's from Teresa. So she caught it from outside of the States. Did she self-quarantine the moment she got back?
And the answer to that is no, and that's why our contact tracing is ongoing at this point. We know there are a number of contacts associated with her ongoing travels after she was symptomatic. And so that's been a busy day for us, but I think at this point, we've got about 70%, more than 70% of the contacts actually contacted and either quarantine if they don't have symptoms or isolating and pending testing for those who do have symptoms.
All right, next question's from Cindy. If you work in Mariposa but live elsewhere, can you still get tested?
Yes, you can. We are looking to test folks who need to come here for work, absolutely.
I'm not sure which. Karen's asking, why aren't you wearing them? I'm not sure what she's referring to. Maybe masks?
Maybe masks.
Okay.
So yeah, one thing I like to talk about is a work bubble and or bubbles in general. The idea is that Siobhan and I are basically in the same work bubble. We share the same environment, the same microbiome, if you will. And so the likelihood of even wearing masks and reducing the transmission of disease between the two of us is very low. Whereas if you're out in public and me transmitting disease to other people, there may be some value to wearing a mask. And then the other thing I like to tell people is, again, you're wearing a mask to prevent the transmission of disease from you to the other person. The mask really is not protecting you as an individual per se. That's why surgical masks and the N95 respirators are important for healthcare workers, because that does decrease transmission of disease to the wearer rather than people who are around the wearer.
And then Jenny is asking, are county workers going to be required to wear face masks to reduce the spread?
So at this point, no. And I think, again, the prevalence of disease in the community, even though we have a cluster here, is leaning me towards not suggesting that. And again, I have to be honest, the science on risk reduction associated with masking is far fuzzier than those other measures that we really espouse, like hand hygiene, covering your cough, staying home if you're sick, things along that lines. Also, the other thing that keeps coming up is wearing of gloves, and hand hygiene is probably as important or more important than wearing gloves in reducing the transmission of disease.
Okay, the next question is from Carla. Where can I find information regarding first responders as regards to testing? Do they need to call and make an appointment, and if so, where?
Yeah, that's a good question. So actually just this evening, I sent a flyer out to, all the agencies that may have first responders associated with them. So what first responders or healthcare workers or even social workers who may have close contact with the public, what they can expect is an email with this flyer to come sometime tomorrow from their employer that gives them the information about how they can register for a test. So for this week, you'll be calling a number, and that number will allow you to register for your test. And testing takes about 5 minutes, and they give you a very specific time slot to go. Starting Saturday, an online registration is going to be up and running starting Saturday morning. And so first responders will be able to get online and sign themselves up for a time after that. So if you have more questions, though, about that, certainly you can get in touch with us here by getting in touch with the COVID helpline at 259-1332 or emailing Mariposa COVID19@gmail.com if you have some specific questions about that.
All right, next question's from Cindy. When will we be approaching phase 2? End of May, early June?
So that's, I think that's a fairly good guess, but as I was talking with our Board of Supervisors today, it really is a best guess because we are waiting for further information from the governor and his staff and from the California Department of Public Health on what really is their timeline and when they're seeing the indicators for relaxing or modifying that stay-at-home order. We do have to wait for them to make that decision.
All right, and Teresa would like to know what businesses will be allowed to open during phase 1.
So phase 1 is right now. And so the businesses that are open right now are those that are allowed in phase 1. Phase 2, which is the next phase, are those non-essential businesses that are perceived as being lower risk. And again, we're kind of still waiting for some details on that. But what we understand so far is that those low-risk, non-essential businesses would be places where there was the ability to maintain social distancing. So car washes, laundromats. I'm trying to think about what other things they cited. Pet groomers, what other things that the governor and Dr. Angel cited on there?
Restaurants.
Yeah, so restaurants that maintain social distancing, so things along that lines. But I think there's still at this point room for some wiggle room on that, and where we talk about what is less risk and what is more risk and how we mitigate risk, and going forward on that.
Next question is from Joy. What is the false negative test result rate for the PCR test approximately?
So it's actually fairly low. The sensitivity and specificity of PCR is up in the upper 90s. So false negative is rare.
All right, next question is from Jennifer. Is the county going to tighten up the guidelines since we have a confirmed case?
So one of the things that so from a law enforcement perspective, and neither of us are the sheriff, but that is one thing that he's considering, and I'm going to defer any further answer on that to him. But I will say, in terms of public health actions, one of the things that changed now that we have a positive case is that we will be basically quarantining the contacts of contacts. So we'll go one row further out in terms of our contact tracing and quarantining them as well. So really trying to nip the bud of transmission and close off that chain of transmission instead of accepting a little bit of risk by only going for one generation deep.
Additionally, one of the early health officer orders that Dr. Sergienko had put out is a febrile respiratory screening order, asking employers who were having employees come in to screen themselves for symptoms prior to coming to work. And so that's been happening regularly at the county. It's been happening regularly at John C. Fremont, and we know a lot of businesses have implemented this. What we are going to do as a result of the knowledge that we have cases is just remind businesses, give them extra tools and reminders that doing this is really important. And so more information will be coming out over Facebook, reminding folks about that FRI screening that we're asking folks to do.
All right, next question's from Julie. Have there been any positive tests in Oakhurst?
I don't believe so. I know that, again, open source media, so I can talk about this in terms of geography, is that the Coarse Post Office did have a case associated with it, and that was probably a couple weeks ago, so no recent activity that I know of.
All right, question from Bridget. What is the expectation of immunization development timeline?
So right now there are some candidate vaccines that are in what are called phase 1 trials, and phase 1 trials are not for efficacy, they're for safety. And so that can take several weeks to months. And then once it's been found to be safe, then they will transition to efficacy trials, phase 2, and that can take through the rest of basically into December, January. And then once it has made its way through phase 2 trials, then they'll ramp up production. And so really what we're looking at is probably the earliest is going to be next spring.
All right, next question is from Cindy. When do you anticipate those of us who are working from home to be able to return to the office?
Yeah, so I'll take that just as an employer perspective for Mariposa County and Mariposa County Health and Human Services specifically. So what we're looking at is in terms of, as Dr. Sergienko said, when the governor spoke today about the phases and the stages with which we're going to go through in order to get people to return back to normal life and normal work. We don't anticipate for a few weeks that we would actually even have our lobbies open. Once our lobbies open, we're still going to continue to do a couple of things as strategies to the extent that we can have folks telework to minimize the number of folks who have to come in the office and risk bringing the virus in. We will continue to do that for some period of time until we hit phase 3 and maybe beyond. And then additionally, to the extent that we have vulnerable populations who work in our agency. So for instance, folks who are over the age of 65 or who have underlying medical issues, we need to continue to protect our vulnerable populations. And so ensuring that we have work for them to do remotely where they're not coming in contact with the public is really important. So once again, we're going to phase it in terms of bringing folks back to the office, but we are looking at what are essential functions of government, what are essential functions of business and life that we have to resume, and that's the decisions we'll be making in terms of bringing people back to the office.
All right. Patricia would like to know, how long will the new testing be available?
That's uncertain right now how long it will be available. We are hoping, just based on our conversations and what we're hearing from the governor, that it could be available for months to come, because we really need to have good surveillance on what the disease is doing and the spread of disease in our community in order to make some of these decisions about opening up and loosening restrictions, if you will. And so hoping to have that available throughout that time. Uncertain though.
Yeah, no, I think that's the case, is that, the intent behind this was to put it in a place where we'd have lots of people to test. Really what they were looking for was a population center of 100,000 people. And we know we're less than that, but that really gives us the advantage of being able to over-test at this point. So I do encourage people that once we've gone through the soft launch and have figured out the hiccups and running people through it, so next week is asymptomatic folks, if they feel like may have encountered someone who has COVID-19, go ahead and get tested.
All right. Next question. Since it has been reported that warm weather and sunlight kill the virus in less time, will people be able to get out in the sunlight more? And do you think this can speed the eradication of the virus?
So just like influenza, is there seasonality with coronaviruses? And that's kind of the question. It's not going to go away. It'll just be less transmissible, because we certainly know in countries that have tropical weather like Singapore, it's still transmitting and going there. But I do expect there will be less activity during the summer. That's the good news. The bad news is I would expect if it does have seasonality, it'll be back in the fall. And that's my larger concern, is I think that we need to be prepared to, again, we may be able to lift some of the containment strategies that we're doing right now, but come fall, come October, November, we may have to layer things back on. And the worst case scenario is it's actually far worse in November and December than it is right now.
All right, next question is from Carrie. How many people are being tested that were in contact with the girl that tested positive? Is there a number of people she was in contact with here in town?
So what I can say is, again, I can't give you a smaller geographic area than the county. But I will say that we're testing at least 7 people. I'm sure I'm probably missing 1 or 2 contacts. But at this point, I think we're testing at least 7 people. Again, more to follow on this, as this is an expanding investigation.
All right, next question from Anna. Will we be told who she is, just in case we know her and may have been around her?
So the answer to that is no. Again, we have privacy laws that we have to adhere to. What we will do, though, is if she identifies you as a close contact, you can expect one of our contact tracing unit personnel to reach out to you. So, and what we think of as close contacts, and that's probably an important thing to mention, is someone who's been in the same space within 6 feet for 10 minutes or longer.
Next question is from Janet. Has the gentleman who brought his wife home from a Turlock Nursing and Rehabilitation Hospital on April 20th been able to get his wife tested? No test as of yesterday. They have 51 confirmed cases.
So yeah, I'm very familiar with that. And so I know that Brenda Sweeney, who's up in North County and is on the hospital board, reached out to me. And so they're in contact with our public health nurse. And so if we can't arrange for testing through the person's private provider, we'll help them do that.
Next question is from Susan. How is quarantine monitored? How do you know if they stay in place?
So we do daily contacts or twice daily contacts with those individuals, and ask them symptoms, ask them to check their temperatures, make sure they don't, so again, quarantine is for people who have no symptoms. So we're checking them for symptoms, and if they develop them, then we test them. And then with isolation, those are all already symptomatic people who are either presumed to be positive or known to be positive, and we check in on them as well. So a lot of it's based upon the willingness of that person to stay in place. If we aren't able to get a hold of them, they aren't staying at home, we have all the way to go ahead and enforce an isolation order by putting them basically in their home and saying, you'll stay here, and having the sheriff's office monitor that. But again, we're hoping for voluntary compliance is our hope.
Yeah, and in addition to that, in order to help with voluntary compliance, we want to make sure that if folks are being asked to isolate or quarantine, that they have all of their needs met in terms of supplies, in terms of medications, in terms of food. And so that's one of the things that our team at Health and Human Services is working on, is when a need like that is identified, we're ensuring that folks get what they need to be able to stay put.
Next question is from Crystal. If you have already gotten COVID, do you know if you can get it again?
So that's a really big question at this point that we don't have a good answer for. And it gets back to also serology testing. Does a positive serology test give you lifelong immunity? 4 weeks ago, I would have said yes, because we know that with other coronaviruses, if you get immunity, whether it's MERS or SARS-CoV, is that you get prolonged immunity. What we're concerned about with COVID-19 is that we find waning antibodies, so you're losing that immune response. That's already being noticed right now. So that's an area for research scientists to look at over the next several months.
All right, thank you. A question from Lori. Do you expect an influx of positive cases with the expansion of testing?
I think it's likely that we will see positive cases with the expansion of testing, yes. And in fact, when we have been planning for testing, we've also been ensuring that our contact tracing team is ready to go, because we do anticipate seeing more positives as a result of this. And it's a good thing. The more we can detect, the more we can put surveillance on this, the more we can do that contact tracing that our teams are ready and prepared to do, and the more that we can stop the spread of transmission. So we do anticipate some increased results.
Question from Jeremy. What if I went to JCF for a test and they turned me away? Can I still test at the new test site?
Yes.
Question from Mary. Do you have to be a resident of Mariposa County to be tested at the new site? How will we prevent surrounding county residents from coming up to the testing facility?
So no, you don't have to be a resident. During the screening process, when folks call the number or screen online, there will be some questions asked, and those questions are basically, where do you reside? They want to understand that there's some tie to Mariposa County. If we're finding that we have a large influx of folks coming from other counties to be tested, that's something that we definitely will have to address during our screening process. However, we do have a lot of back and forth between counties like Merced, counties like Oakhurst, places like Oakhurst and Madera County. And so we are not at this point keeping folks away from being tested. As we know, there's a lot of back and forth, but we are prioritizing our county residents, and we're prioritizing folks who may live elsewhere but may work in our county.
All right, next question is from Jenny. Why do the president and the governor have different plans, and which one should we follow?
So it's a great question, because I have the same question. And so public health resides at the state level, and that's under the Constitution, under the 10th Amendment. So realistically, we should follow the governor's guidance and his public health orders, the health orders of the state health officer. That said, I'm always willing to accept or incorporate good ideas from the federal plans, because there is good guidance in the Open America Again plan that that actually align with the governor's plan, but actually provide a little more clarity. And so what we've been doing here in our planning process is looking at what parts of that federal plan we can incorporate into our local plan.
All right, next question from Terry. Will you be updating us weekly? Thank you.
So I think we're actually, so I'll be here whenever you guys, I shouldn't say whenever you want, but I think we like this interface. But I will say that the Joint Information Center, the JIC team, is doing multiple posts daily, plus the daily update. So there's always good information on our Facebook page to keep you informed of what's going on.
And as we go through these phases of reopening, we definitely want you to hear from other partners. We want you to hear from our business community in terms of what businesses are doing and guidelines. We want you to hear from our schools. And so we are working with our partners to ensure that forums like this will be available to you so that you can get your questions answered about multiple different strategies and activities, and not just hear from us.
And along those lines, if there's people that we haven't mentioned that you'd like to hear from, please text or Facebook Messenger us, and we'll see what we can do to bring people on here, whether it's, again, the schools, business, or something else that you're interested in learning about.
All right, next question is from Tammy. If an asymptomatic person chooses to be tested and comes back negative, would you recommend that they retest? And if so, how often?
Every 2 weeks.
Right, so with asymptomatic people, we know that there is asymptomatic carriage of the virus, and there's the potential you could be infected and not know it. But we also know the incubation period is about 2 weeks. That's why we're saying 14 days is about the right time to retest if that's something you'd like to do.
And I will just add, as Dr. Sergienko's mentioned, if somebody's come in contact with a person who is positive for COVID, the virus may not show up for a period of days. So getting tested right away. So if I knew that Dr. Sergienko tested positive yesterday, me testing today may not yield results that are positive. It may be helpful for me to quarantine myself and wait a few days and then get tested. It could be 5 or 6 days, I think.
Right, so incubation period anywhere from 2 to 14 days, with the mean incubation period being 5 to 6 days.
Question from Ben. So if I am sick, should I go to JCF or to the testing site?
So it depends on how sick you are. And if you feel like you need to see a doctor now, and I think that's actually a really important thing, is if you feel like you need medical attention, don't wait to go to the testing center.
Right.
Go see JCF or go see your medical provider and get that evaluation. On the other hand, if you have mild symptoms that you feel like, okay, maybe I would just manage this at home on a regular basis, then you can wait for the testing center. So serious enough symptoms where you think I need to see a doctor, or maybe so serious that you need to see the emergency department, don't wait for the testing center. Go ahead and see the providers at John C. Fremont or wherever you see your provider.
So if you do have mild symptoms and today, and you feel like you might want to be tested on Thursday, please go ahead and call our info line at 259-1332, and we will get you that information to be able to sign up for testing. So once again, we're prioritizing for this week on Thursday and Friday, first responders, healthcare workers. However, if folks are symptomatic as well, then we would like to get you in as well this coming Thursday or Friday.
All right. Thomas would like to know, where is the new testing site?
The new testing site is going to be located at the old middle school, which is currently the alternate education school on Silva Road in Boot Jack. So 5171 Silva Road.
All right. Question from Travis. Should a regular person test every 14 days too, or just first responders?
I think it depends upon your interest in knowing that. If, as I said, if we've got 132 spaces here and they're not getting used, we may get that testing capability taken away from us, and that would be to our disadvantage.
Mm-hmm.
And so the more people we have running through the testing, even if it's repeat customers, that lets me know from a public health perspective what the prevalence of the disease is. So that gives us more information. And if you're willing to do that and we have the space available, we won't turn you away.
And just to add on that a little further, if someone's staying sequestered and is often just by themselves, getting tested every 2 weeks is probably not necessary. It's really for folks who are coming into contact with the public or close contact. That's the folks who we think getting tested every 2 weeks makes sense for.
All right, next question is from Catherine. I need to have routine labs for lupus. Am I putting myself at greater risk by going to a lab where testing is being done?
I was going to say, in terms of the specimen collection site, the way it is set up and orchestrated is that they really, the reason you have to call, the reason you have to make an appointment is it's set up in time so that you avoid contact with other individuals. And so the likelihood of you getting it from the exposure there is fairly low. And I also think that, again, another option, JCF does their drive-through testing. And so that gives you minimal risk. But if you're talking about lab draws, blood work, things like that, I think John C. Fremont's a good option because all of their COVID testing is happening through their drive-through.
All right, next question is from Jill. If the park reopens, how will the county respond to potential travelers?
So we're through the Yosemite Gateway Area Coordination Team, which includes the park and the 3 gateway counties on the west side, Tuolumne, Mariposa, Madeira, is we're moving in close order fashion with each other. Is that their intent is not to open until we're ready to accept travelers. So they're looking at the guidance we're developing locally, which is also based on the state stuff. And so they're moving together with us. We would not anticipate them to open until we're ready to accept travelers here in Mariposa.
A question from Sandra. With the possibility of the influx of positive cases, will our contact tracing team be able to handle it? And what happens if they become overwhelmed?
Yeah, so we feel really good about our contact tracing capability right now. It's a partnership currently between our public health team. They serve as the subject matter experts. Our law enforcement, probation staff, DA investigator, who have the skills to be able to find people quickly, as we know. And so we have a really good sized team right now. We have already been planning for what will happen if we need to continue to expand that team. We do have folks in the community who we can train. The state's been putting together some really good training materials that they're making accessible. Additionally, the state is training state employees who can be repurposed to communities that need additional contact tracing capacity. We don't anticipate needing that at this point because we do feel like we have a team who's prepared and ready and been ready to take more cases. So we feel our capacity is good.
All right. Last 2 questions. Are smokers an at-risk group?
So we've not seen that directly where tobacco use, except in, I want to say, some speculation. We know that males have more severe disease than females, and males are more likely to be smokers than females. So there's some suggestion there in pulling that out. And then the confounding factor is that some of the bigger comorbidities or other diseases that lead to problems are also associated with smokers, like heart disease and hypertension. So teasing that particular thread out has been difficult at this point.
All right, and the final question, what are the hours of the new testing site on Silva Road?
So the hours will be 7 a.m. to 7 p.m. Tuesday through Saturday.
All right, thank you everyone. You guys have any final thoughts?
So as always, stay safe, wash your hands, cover your cough, stay at home if you're sick. Don't touch your eyes, your nose, your throat, and we'll see you next time.
Thank you.